Hi, good afternoon. My name is Betty Stewart. I'm one of the nurse educators at Brooklyn Hospital Medical Center. Welcome to Ask a Nurse web series. Okay. My topic today is COVID-19 and influenza, tips for pregnant people. Okay. When we talk about COVID-19, we have the CDC and other researchers continue to study the effects of COVID-19 on pregnancy. As of this time, with the current research, pregnant people might be at an increased risk for severe illness from COVID-19 when we compare them to non-pregnant people. Pregnant people with COVID-19 may be at an increased risk for other adverse outcomes, such as preterm pregnancy. If we look at the cases, we see that there have been 25,351 cases of COVID-19 and a total of 44 deaths. Statistics also show that the highest age group affected by COVID-19 is the age from 25 to 29. And when we look at the ethnic group, we see that Hispanic or the Latino have been highest affected by COVID-19, followed by the white non-Hispanic, the Black non-Hispanic, and multiple other non-Hispanic race groups. The one with the lowest influence has the Asian non-Hispanic group. So as you see, COVID-19 affects us all. The total hospitalized cases has been 5,894. With that, the highest number admitted to the highest ICU is 216, and followed by those on mechanical ventilators have been 79. We think of tips how to help the pregnant women in terms of not to experience symptoms of COVID-19. We talk about social distancing, maintaining that 6 feet apart. Wearing your face mask, covering both your mouth and your nose. Strict hand washing, whether you use soap and water or hand sanitizers with alcohol contents greater than 60%. And if possible, stay at home and no social gathering. Tip number 1, don't skip on your doctor's appointment. Healthcare appointments during and after pregnancy are important. Talk to your doctor, your healthcare providers about how to take care of yourself and your baby and to stay healthy. Questions you may have asked regarding the best place for you to deliver your baby. Delivering your baby with a trained healthcare professional is the best and the safest way. Okay? Always make sure you have a good supply of your medication at home. So talk to your doctor, talk to your pharmacy, and make sure you have at least a 30-day supply. Tip number 2, if you're concerned about going to your appointments because of COVID-19, ask your doctor or healthcare provider what steps they're taking to separate sick patients from healthy patients. Some healthcare providers may choose to postpone or cancel some visits. Others may switch certain appointments to telemedicine visits, which are appointments over the video or phone. These decisions may be based on the individual health risk and situations in your community. Tip number 3, get the recommended vaccine to protect you and your baby. One of the vaccines is the whooping cough vaccine. Another name is Tdap. Your body creates protective antibodies and pass it on to the baby after birth. Whooping cough is also known as pertussis, can be serious for anyone, but for a newborn, it can be life-threatening. There have been known to 7 out of 10 deaths from whooping cough can happen to our babies younger than 2 months of age. Okay. Another vaccine is the Hepatitis B vaccine. Babies whose mom with hepatitis B or are at high risk of getting the same infection during delivery. So please consult your doctor, your healthcare provider for testing and to see if you need this vaccine. Hepatitis A vaccine. If you have a history of chronic liver disease, your healthcare provider may recommend this vaccine. And most important now is the flu vaccine. It's now flu season, and we recommend that you get this vaccine by the ending of October. Even though October is just about ending, it's never too late to get your vaccine. Timing is important. Next topic is influenza and our pregnant people. Influenza has the high likelihood to cause severe illness in pregnant women. Pregnant women and women up to 2 weeks postpartum are more prone to severe illness from the flu because of changes in their immune system, their lungs, and heart. This illness can result in hospitalization. This illness can affect the development of the baby in the womb. A pregnant person who received the flu vaccine can pass on antibodies to the developing baby so that it can protect the baby from the illness. The CDC and other research studies have shown that giving the flu vaccine during pregnancy is safe. Pregnant women should get a flu shot, not the nasal spray. People with egg allergies can receive the flu shot from a licensed practitioner, and you'll get the vaccine that's age appropriate. Pregnant women who have a history of severe egg allergies can be vaccinated too, but we recommend that the vaccination be done in a medical setting. Okay? This way any reaction occur, it can be recognized and managed safely. Some of the side effects are soreness, redness, and swelling at the site, headaches, fever, muscle ache, nausea, fatigue, and fainting. If the side effects occur, it generally begins at least on 1 to 2 days after the shot has been given. If you're sick from COVID-19, please wait until you no longer have symptoms and check with your healthcare provider on when to get the flu vaccine. Okay, further tips for the pregnant people. If you get the flu, make sure you get plenty of rest, drink plenty of fluid, eat immune-boosting food, such as food rich in vitamin C and zinc. Take your prenatal vitamins. Consult with your healthcare provider before you take any over-the-counter medication and prescription medication. Okay. People at high risk for influenza complication should be advised to call their provider, their MD, as soon as possible. As soon as if you are experiencing any acute respiratory illness symptoms, such with or without fever. You can also schedule an appointment at the Brooklyn Hospital Center using My Chart, or open scheduling. The website is www.tbh.org/appointments or mychart.tbh.org/mychart/opening scheduling. Okay. For further information, here are some references that you can use to gain some more information on the effect of pregnancy and the COVID virus and the flu. Okay, thank you. I hope this has been helpful to you. If you have any questions or any comments, please leave us a message. Thank you once again. Bye-bye.